the plan is underpinned by 3 or 4 different principles. Number 1 is transition outpatient services away from the building with a long-term plan of actually closing MWI. We know there's a stigma attached to the building. It's still known as abundance to a lot of people. However, if we can make our services accessible to individuals, we think we can support individuals better. Second one is really around focusing on the patient, having a recovery model, which is based on providing hope, empowerment to the patient, the patients having a bigger say in terms of their treatment. Third one is really about having more of a needs-based approach to our patients so that it's not just based on your diagnosis, it's based on what you need in terms of service support. And finally, the biggest one, which I think is going to have pay dividends down the road, is trying to reduce the stigma that's attached with mental illness or with intellectual disability, and how we as a country need to do a better job in terms of recognizing and normalizing mental health concerns within our community.
People might be quite scared to think, wow, MWI is essentially going to be closing in the years to come. But we have to have it on a parity with physical care to sort of normalize mental health. I mean, the World Health Organization will quote, no health without mental health. So, you know, that's just such a massive part of our own physical health journey. And we have to meet patients where they're at. We've already started, as you heard, last year, we started the satellite clinics on the island within the urgent care setting, and then more recently within the Victoria Street Clinic. And that's just really providing care closer to home. And we're just, you know, meeting the patients where they need to be. And then if we think about trying to surmount a potential barrier of coming to MWI and having to admit that you might need some help for your mental health, that's a really hard bar for some people to get over. So that's why we're trying to be more thoughtful around how we might deliver care and again, meeting their patients where they're at.